Okay, so like everyone loves wine.
Yeah.
It's everywhere. It's been around forever.
Right.
And everybody always says it's, good for you.
Yeah.
Red wine especially. But
Hmm.
is it really?
Yeah, that's the question.
Like, is there actual science behind it?
Yeah.
Or is it just like wishful thinking?
Yeah.
That's what we're diving into today. We've got all this research here.
Right.
Because, wine has been part of cultures all over the world for centuries.
For millennia.
Yeah, millennia.
Yeah.
Like way before modern medicine.
Exactly.
So it's tempting to think, well, maybe they were onto something.
Right. Yeah, like maybe they knew.
Like, did they live long lives because of the wine?
Yeah.
Or just in spite of it?
Exactly. That's the big question. Is
Yeah.
it correlation or is it causation?
Yeah.
And that's where things get really interesting.
Yeah.
Because you've got the Mediterranean diet, which everyone's always going on about.
Right, super healthy.
It's great. Lots of fruits, veggies, olive oil.
Right.
And, oh yeah, wine in moderation.
Right.
But how do you tease apart what's really doing the heavy lifting there?
It's like you see someone wearing running shoes.
Right.
Doesn't mean they're training for a marathon.
Exactly.
You could just be, running to the store for snacks.
Yeah.
Right.
You don't know.
So let's get specific. Everyone always talks about antioxidants, especially in red wine.
Yes.
What's the real deal with those?
So red wine does have antioxidants, right?
Okay.
And one that gets a lot of attention is resveratrol.
Resveratrol. Yeah, I've heard of
It's
that.
been studied a lot,
Okay.
like in the lab.
Yeah.
And there is some research that suggests it could protect against heart disease,
Oh, wow.
even some types of cancer.
Okay. So that sounds pretty promising.
It does, but it's not a slam dunk.
Right. Our sources mentioned that resveratrol is not just in wine.
Exactly.
It's in grapes, berries.
All sorts of things.
So are we better off just like snacking on grapes?
That's a great question.
Right.
And it brings up the idea of bioavailability.
Bioavailability, okay.
Which is how much of something your body actually absorbs
Okay.
and uses, right?
So like we could eat a ton of something,
Right.
but if our body can't process it,
Exactly.
it's not doing much good.
It's going in one end and out the other.
Okay.
And resveratrol from wine might be absorbed differently than from other sources.
Okay.
Plus, the amount in a single glass of wine is pretty tiny compared to like a big handful of grapes.
Right, right.
You'd have to drink a lot of wine to get the same amount.
And that's probably not a good idea.
Probably not.
So it's not just about what's in the wine, it's also about how our bodies use it.
Right, exactly.
And this makes me think about how wine is actually made,
Oh, yeah, that's a whole other.
like different techniques, different grapes.
Yeah, absolutely.
Our sources mentioned that could affect the antioxidant levels.
It could.
So
Yeah.
is my fancy aged Cabernet like a health powerhouse
That's what everyone wants to know, right?
compared to just, a regular table wine?
Yeah, but it's tough to say for sure.
Right.
Researchers are still figuring that out.
Okay.
There are studies that suggest some grape varieties.
Mhm.
And winemaking methods might lead to higher antioxidant content,
Okay.
but it's not as simple as expensive equals healthy.
Right, right.
There are just so many factors.
It's back to nuance again.
Always nuance.
Right.
It's complicated.
It's complicated.
Yeah.
This is all super interesting, but let's be real. Wine is still alcohol.
At the end of the day, yeah,
And our sources are pretty clear that even moderate drinking has risks.
it does.
So how do we balance like the potential good with the potential bad?
That's the million-dollar question, isn't it?
It is.
And I think it comes down to personal choice
Right.
and really understanding your own health situation.
Correct.
Moderate wine consumption might have some benefits for some people,
Right.
but it's not a free pass.
Right.
You have to think about your overall health, family history.
Right. Are you predisposed to certain conditions?
Exactly. And any potential risks.
Right.
And let's not forget, wine is delicious. It's meant to be enjoyed responsibly, of course.
Of course.
But it's not a magic potion.
Right.
And it's definitely not a substitute for a healthy lifestyle.
Yeah, you can't just eat pizza and drink wine all day
Exactly.
and call it a balanced diet.
Exactly.
So, if you're really worried about the health effects of alcohol,
Yeah.
talk to your doctor.
Absolutely.
They can help you figure out what's best for you.
Based on your individual situation.
Right. They know your medical history.
Exactly.
So next time you're, swirling that glass of Merlot,
Yeah,
remember, wine is complex,
it is.
both in its taste
Absolutely.
and its effects.
Yes.
Enjoy it, but do so mindfully.
Be mindful.
And don't believe all the hype.
Exactly. Be skeptical.
And here's something else to think about. Like, how do different cultures view this whole wine and health thing.
Yeah.
Is it like mainly a Western idea? Or does it show up in other parts of the world too? I don't know. That's something to ponder.
Yeah, that is interesting.
Right. Thanks for listening, everybody.
Cheers.